Dear students, welcome back. So as we were discussed about the health, what is health? Health is when we are free from illness or injury, so we are saying that we are healthy. Then we discussed the three factors. The three factors are adequate food, pollution-free environment and the clean drinking water. These three factors are very important to be healthy. Now let's discuss some of the cons of healthcare in India. First, we discussed that every year approximately 15,000 doctors they are getting their degree and become the doctor. So every year we are getting the n number of doctors. In spite of so many doctors, these doctors they settle in the urban areas. Why it is so? They don't want to live in a rural area. It is because these people they need a dual source of money. First from government and second from their own clinic. As this opportunity they cannot get in the village, so they are moving towards the urban areas. And the people who are living in the rural area, they have to suffer a lot. They have to travel from their village to the urban areas to get a better treatment. So we can say the number of the doctors with respect to the population is less than the rural area people. Because in rural area only we are not having a sufficient doctor. In urban area we are having so many doctors, but in compare of the population of the rural area, the doctors are very less. And also we discussed the second point that every year we are getting so many hospitals and professional doctors. So after having so many hospitals and the professional doctors, every year 5 lakh people they died because of the tuberculosis. What is this tuberculosis? It means TB. So this ratio is unchanged from the independence, because from the day we get the independence, the people they are suffering from this disease and they are dying with this disease. And also every year we are getting the 2 million cases of the malaria, and it is increasing day by day but not the decreasing way. So the third point that we discussed, that is the medical tourist. Every year we are getting n numbers of medical tourists. They are coming from their country to India for their treatment. As they are coming from the treatment, because they cannot afford the money of their hospital and the doctors of their own country. So what are the things that they are not getting in India? That is the clean drinking water. In India, they are not getting the clean drinking water and some of the disease that is prone to water only. And in India, 21% of the population, they are not getting clean drinking water. So some of the diseases are the communicable diseases, diarrhea, worms, hepatitis, etc. Hepatitis is a disease that damages the liver. Alright, then the last point that we discussed, that in India, it is the third largest producers of the medicines and the exporter also. In spite of all this, that we are getting the money also.
Poor quality of water leads to a rise in many communicable diseases like cholera, typhoid and jaundice. In addition to that, the sources of such poor quality of water often act as a breeding ground for practices and insects. Particularly, stagnant water can cause mosquitoes to breed, which are the agents of chikungunya, dengue, malaria, etc. Eliminating these breeding grounds for parasites will prove crucial in improving the health conditions of the populace living nearby.
So So in spite of all this, the half of all the children in India do not get adequate food to eat and are undernourished. As in India, we are having so many facilities that we talked about, that we are having the 15,000 doctors every year we are getting, and so many hospitals that are increasing year by year. Also, we are having the people who are coming from their country to India, so we are getting money also. And when we are exporting the medicines, we are getting money also. But after having money, knowledge, and the development, the professional that we are having, after having so many professional, why in India that the facilities are not getting to all? At least the poor people should get these facilities, because the rich, they can afford the private hospitals, but the poor, they have to go to the government hospitals only. And in government hospital, how these people, they are facing the problems that the doctors, they don't want to live in rural area, and the people, they are undernourished. The children, they are undernourished, and as they are not getting the clean drinking water. So let us discuss this, that how the Hakim Sheikh reacted after he does not get the proper treatment in the government hospital. So let's discuss the story of the Hakim Sheikh. Hakim Sheikh, as he was a member of Paschim Bengal Khet Mazdoor Samiti, is an organization of agriculture laborers in West Bengal. Once in evening 1992, he fell off from the running train and had injuries. And then he needed to admit it in the hospital. Then he was taken to the government hospital, where the government hospital, it refused to him that he cannot admit it in the hospital because did not have any spare bed. So he moved to another hospital, and this hospital also refused him by saying that the professional doctors are not there. Then, after spending 40 hours in critical state, after going 8 different government hospitals, he went 8 different government hospitals, and he was not admitted there because of they were having so many reasons. So then finally he admitted in the private hospital, where he was treated properly, the proper treatment was given, and he got well. So now the Hakim said he got angry and furious against this government hospital and the government, and then he filed a case against them. So the case he filed against the government in the government hospital, is it right? On what basis he can file a case? So on what basis the Hakim Sheikh filed the case against the government hospital? What is the reason behind it? What is the role of the text here? Let us discuss. As we all know that we are paying tax to government. So what is the reason that we are paying taxes to the government? It is because when we are paying taxes to the government, so government is providing us the services, the public services. Alright? So the public services that we are getting, okay, it is because of the tax we are filling. The government is taking the money from us as a form of tax, and the government is returning us that tax in the form of the public services. The services are the police, the defense. These are to protect ourselves from the enemy or the protect from all the illness that is going on the society. And the judicial system and the highways. These people who are working in these services, so from where they are getting the money? If these people they are getting money, that's why they are working for us. So the tax we are paying, the government is paying the same tax in the form of salary to these people. And also the tax we are paying to the government, it is funded to the development programs. The programs are the education. In education, the teachers that are getting the salary, from where they are getting the salary? The midday meal, as we discussed in the previous chapter, the midday meal, it is started to give the food, the sufficient food to the children. From where they are getting this food? And the health services, and it has also come in the development programs. The health services, the doctors, from where they are getting the money, their salary. The equipment, from where they are, how they are buying that equipment. And the employment, if the people they are getting employment in the government services, the health services, in the education and all, so from where they are getting the money. And social welfare. So these all welfare programs, these all development program, it is funded with our money, with the tax that we are paying to the government. Okay, and also tax money is utilized for relief in rehabilitation in case of natural disasters. And also the tax we are paying to the government, it is utilized when there is any of the natural disaster like the tsunami, the flood. Okay, these are the things that these are the natural disaster when they took place. The government, when it gives the relief to the people, so from where they are getting the money? So this is the money that we are paying in the form of the tax. So that's why the Hakim said he was furious, he was very angry because he was paying the tax and in return he is not getting nothing. So this is what the government program. So that's why the Hakim said now he filed the case. So that's why the Hakim said he filed the case against the government hospital because he was paying the tax but in return he is not getting anything.
As of 2013, the number of trained medical practitioners in the country was as high as 1.4 million, including 0.7 million graduate allopathes, yet India has failed to reach its Millennium Development Goals related to health. The definition of the access is the ability to receive services of a certain quality at a specific cost and convenience. The healthcare system of India is lacking in three factors related to access to healthcare: provision, utilization, and attainment. Provision or the supply or the healthcare facilities can lead to utilization and finally attainment of good health. However, there currently exists a huge gap between these factors, leading to a collapsed system with insufficient access to healthcare. Differential distributions of services, power, and the resources have resulted in inequalities in healthcare access. Access and entry into hospitals depend on gender, socio-economic status, education, wealth, and location of a residence, means urban versus rural. Furthermore, inequalities in financing, healthcare, and distance from healthcare facilities are barriers to access. That's all for this video. See you in the next video with the same chapter. Till then, stay happy.